There are three serious problems unique to marathon running that you really must correctly identify and treat: cardiac events, heat stroke, and hyponatremia. For cardiac issues, you'll treat these as any other patients that you'd see in your normal practice, along your local protocols with emergent transport to the hospital. We do not want to see these people in the main medical tent. The other two issues involve some form of altered mental status, such as confusion, apathy, irritability, or obvious delirium. The first step in assessing a collapsed athlete with altered mental status is to take their temperature. An oral or tympanic temperature greater than 100.5 Fahrenheit dictates that a rectal temperature really should be taken. A rectal temperature of greater than 104 degrees Fahrenheit is defined as heat stroke, and this is a medical emergency. Your objective is to cool the athlete as rapidly as possible to less than 102 degrees Fahrenheit, and that determines their survival. The approach is to cool first and transport second. Immediate immersion in ice water is the preferred method of cooling and will take place in the main medical tent. An alternative method is to use rotating ice towels on all of the extremities and the trunk, and that'll be done in our course aid stations. You should start treatment with an IV of 500 mL normal saline or D5 normal saline as a bolus, then run another 500 mL over 30 to 60 minutes based on your clinical judgment. Transportation of these athletes should be to the main medical tent because hospital emergency rooms are not really well equipped to do cold water immersion. Really, the last thing that you want to do is be caught in traffic and delay cooling to these athletes.